Hello, I'm Dr. Demerjian. I'm going to be explaining the Somnomed dental sleep appliance, the HERBST version of the dental sleep appliance. As we open the container, you're going to be getting a set of instructions. It comes with the dental sleep appliance and a bunch of stone models, the impressions, and the bite registration. Everything that was used to make the mouthpieces right here. As we take off the lid, your box has the container in it, and underneath the container houses a little compartment that has the tiny brush and the key for adjusting. In these instructions comes cleaning instructions, warranty, wear and care instructions, and they're also giving you a couple of cleaning tablets to try. Other than their instructions, I'm going to be giving you my personal instructions, talking about how to take care of it. I basically want you to brush the mouthpiece just like you brush your teeth at least twice a day. If you can get an extra toothbrush and use soap and water like Dawn dishwashing soap, it'll scrub it and keep it super clean. And then in the evenings, when you brush it, use your toothbrush toothpaste, rinse it off, put it in your mouth. During the daytime, when storing it, I want you to put the lid just slightly open and let it air dry so it doesn't pick up mold, mildew type stain. And when wearing it, I'm going to be explaining how to wear it. When putting in the mouthpiece, put it in 30 minutes before sleeping so you get used to having it in your mouth and taking it off. After the first week of putting it in 30 minutes before sleeping, the second week you just pop it in and go to sleep. The first week, you're not going to make any adjustments to it. The second week, you're going to start doing a 1 millimeter adjustment. And as you put it on, I want you to put on the top first, and your mouthpiece has a little arrow pointing up, telling you which arch is up. And then when putting it in, you put the front teeth, push the back into place, and then fit the lower teeth and push the back into place. When taking it off, you're going to do the reverse. You're going to come to the molars on the lower arch and wiggle it off from the back, and then pull it down from the back from the upper teeth, and then take out the mouthpiece. Now we're going to talk about adjusting the mouthpiece. In the instructions from Somnomed, if you open it to the middle, there are pictures showing you how to adjust the mouthpiece and how to advance it. Okay, the mouthpiece has the upper arrow pointing up, and then it has this numbering system here on the side with 0, 2, 4, 6, 8, and your mouthpiece is set at number 1, so we have a millimeter to go backwards if we need to. In the middle part here is threaded screw, and the head of the screw is back here. And if you take the key and fit it from underneath and turn it, that moves the screw forward 1/10 of a millimeter. You put it in again, turn it again, that's 2/10. 10 turns will make this little line here move forward to the number 2 setting. So your goal is after 10 turns, you wear it a week, and then you do another 10 turns the third week and see where you are. And if you're not snoring and waking up rested, that's where you stay until we talk. I'm going to review the bite exercises that I want you to do in the mornings after you take out your dental sleep appliance during those 20 to 30 minutes before you put the AM aligner in. In the mornings, what I want you to do is put your tongue up and back and bite on your molars and clench and squeeze a few times to kind of reset the bite back into place. Because the dental sleep appliance is meant to bring the jaw forward to open up the airway, and we want to counteract that by doing the bite exercises. Second bite exercise, I call it the chin rest. It's kind of like sitting there pushing on your chin, but don't push up, push in. And what you want to do is, if you use your hand or your fingers to push the jaw back, relax your jaw and clench and squeeze. That kind of resets the joint back into place. And thirdly, if you tilt your head back, relax your jaw, and let your jaw go back, bite on your molars, and bring your head forward, you're going to notice that your back teeth are touching. After you start doing some of that for a few minutes, I'm going to be personally making you the AM aligner that you're going to wear in the mornings. After you take out your sleep apnea mouthpiece, you're going to give your jaw a break for 20 minutes or so. Do some bite exercises. Put this in and just bite and rest into it as part of your morning routine. For gentlemen, I will be saying that as you shave and shower, and for the ladies, as you shower, hair, makeup, as part of your daily routine to do it. Also, one more time regarding the care instructions, I want you to mechanically brush, just like you brush your teeth, you take the plaque and tartar off, do the same thing to the mouthpiece. Don't just use the cleaning tablets only, so get an extra toothbrush, put a drop of dish soap, scrub it, rinse it off, put it in here, and leave the lid slightly open to let it air dry. And in the evenings when you brush your teeth, take the toothbrush, toothpaste, scrub the mouthpiece so it tastes good, rinse it off, put it in your mouth, and go to sleep hopefully. Thank you for your time, and I hope this helps.